Yeah.
Okay, we're ready to go. Good morning.
No, it was not. It was,
And, oh, we need that? Good morning. And in honor of St. Patrick's Day coming up later this week, top of the morning to ya. Commissioner, staff, and guest, please rise for our invocation and pledge of allegiance with Commissioner Hatfield.
Heavenly Father, we thank you for the many benefits that you have bestowed upon us, for the quality of life and the freedoms that we enjoy. We pray that you continue to guide us as we work for the betterment of Berry County and all of its citizens. In Jesus' name we pray. Amen.
Amen. I pledge
Pledge
allegiance
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
You may be seated. For purposes of attendance, Madam Clerk, will you call the roll?
Carlton?
present.
Gephardt?
Here.
Doster?
Present.
Getty?
Here.
Hatfield?
Here.
Smoker?
Here.
Tunison?
Here.
Jackson?
Here. Approval of written agenda. At this time, any member of the board or public may ask for an item to be removed from the consent agenda and placed under items for consideration. We are going to remove item G from the consent agenda to items for consideration. Michael and Dave Shinovar have some additional information to share with us on a request for that. So item G, please move that. Is there any additional request? Hearing none, the agenda is approved as written. Reports from state and county officers. Good morning, Sheriff.
I've got one report. My lieutenant back in the jail was ill today, so. All right, Berry County Law Enforcement logged 585 complaints in the month of February. 22 individuals were arrested. There were 69 accidents handled. 44 involved those deer. 4 involved alcohol and or drugs. 389 criminal histories were run for warrant entry and warrant requests. 66 sex offenders were processed. 317 pistols were processed. In 2023, 585. In 2018, we had 626. That's, I don't know if we've, for the new ones, that's, we go back 5 years. Accidents handled was 69, and then 2018 was 79. Car deer accidents, 2023 is 44. 2018 was 49. Arrests were 22 in 2023, and then 2018 was 47. Alcohol and drug-related arrests, 8, and then 6 in 2018. Any questions?
Questions or comments for the sheriff?
Easy crowd, thanks.
There you go. Thank you. Additional reports from state and county officers? I do not see anybody else here. Limited public comment. At this time, any member of the public wishing to address the board may do so for up to 3 minutes.
Good morning. Rick Moore, still harbor master of the Podunk Lake Yacht Club. I like to remind members and guests to please speak into the microphone or use your outdoor voice, or perhaps even both. And thank you very much to the board for all the work you do. I appreciate it.
Thank you. Is there additional public comment? Hearing none, we will move ahead with our agenda. Various correspondence. Does any commissioner have any correspondence they would like to share with the board? Okay. Consent agenda. Commissioner Getty.
I move for the approval of the February 28th, 2023 Board of Commissioner meeting minutes, the approval of the March 7th, 2023 Committee of the Whole meeting minutes, approval to promote Joshua Carter from Assistant Prosecutor to Senior Assistant Prosecutor effective January 1st, excuse me, 2023, approval of the Land Information Services Open Data Policy and the amended Land Information Services fee schedule for data and map products, approval of the grant draft agreement between Michigan Department of Ag and Rural Development and Berry County for the Susan K. Butler Farm, and authorize the chair to sign the final agreement. Approval of the purchase agreement and conservation easement between Berry County and James and Barbara Wickham for property located in Carlton Township, and authorize the chair to sign.
Is there support?
Support.
Motion by Getty, support by Hatfield. For all items listed on the consent agenda, discussion is not allowed and a roll call vote is required. All those in favor vote aye. Opposed, nay. Madam Clerk, will you call the roll?
Halsey,
Aye.
Campbell,
Aye.
Joster,
Aye.
Getty,
Aye.
Hatfield,
Aye.
Smoker,
Aye.
Tunison,
Aye.
Jackson.
Aye. The consent agenda is approved. Presentations. Today we have with us Rich Timke from Berry County Community Mental Health.
Yeah, I have, well, good morning.
Morning.
I'm Rich Timke, Executive Director at Berry County Community Mental Health, and I'll let Kristen introduce herself.
Good morning, I'm Kristen Kostelik. I'm the Integrated Care Supervisor over at Berry County Community Mental Health.
So our goal today is just to kind of give you some information on Berry County Community Mental Health, who we are and what we do, and then a little bit of information on the grant, the federal grant that we received, which allows us to do a little bit more integration and a little bit more expansion of access to services. So with that being said, moving on with who we are an agency that provides behavioral health, physical health, and substance use treatment, and we do that for all ages. So we have a program for infant mental health all the way up to older senior adults, so full gamut. And we do that work in conjunction with community partners. So we have a lot of partnerships with law enforcement, with jail, with schools, with the hospitals. The work we do is community work. So The second slide you see in your packet talks about the need for mental health, not just in our area, but nationally. So the prevalence of mental health, and some of these stats you've probably seen or heard before, but 1 in 5 individuals have a experience of mental illness, 1 in 20 a severe mental illness. And then we're talking about kids, about 70% of our adolescents or youth that will experience a mental health disorder. And so I just broke that data down specifically for Berry County, just to give you an idea of what that might look like in our county, and so the need, why we need to engage in these services here in Berry County. And you see that data comes from NAMI, which is National Association for Mental Illness. That data is a couple years old. Some of those stats might actually be bumped up a little bit based on the pandemic, but nevertheless, you get an idea that there is a need even here within Berry County. The next slide shows you, again, continuing on with the need in the mental health and substance use disorder affects all areas of society. So obviously it affects the individual, it affects economics that we engage in, so all in social impact as well. And you see based on that first bullet point there that individuals with depression have a much higher rate of developing heart disease and other ailments. And that last bullet point talks about that almost 21% of individuals experiencing homelessness have a serious mental illness. So again, it impacts all aspects of society, and that's no different than in Berry County here as well. And so the question then is, how do we engage our county and our citizens to overcome those hurdles or those barriers? Well, we do that. We have several strategic focus areas in 2023 and into 24 that we're working on. So what we're doing is working on increasing integration, which is physical health and behavioral health, merging those together. Several years ago, the state of Michigan separated the head and the body, and we're working to put those back together. The state is as well. Increasing access to treatment. So we just want to open the door to have more people available to receive services. Enhance QI metrics, so quality and improvement metrics. So what we want to do is we want to help individuals on their path to recovery, right? Whatever that is. And then we want to measure, are we doing a good job of that? And sometimes we find out that, you know, we tried something and hey, that didn't quite work, so we need to step back, we need to reevaluate and then measure again. And sometimes we find out that we are actually improving those lives of individuals, and we want to keep doing that. We want to engage in outreach, so part of that is just getting the message out to individuals to say what we do, how we do that. And then part of that engagement is actually going out to places in the community where people might not be able to come into our facility, and Kristen will touch base on that in a little bit. And then we're also focusing on increasing or looking at social determinants of health. So specifically, like, we want to help individuals increase their employment opportunities. We want to help individuals increase their housing opportunities. You know, if individuals are working, they have disposable income, so they can make more choices for themselves, right? So those are kind of the areas that we're working on. And so on the next couple of slides, you'll see that how we go about doing that. What are the actual services in Berry County Community Mental Health that we do to help those individuals on their path to recovery, right? And so some of these services you're going to see and you'll be familiar with, and some are going to be new. Like the familiar ones might be like ABA, autism services, or the testing for autism. We do that in-house as well. Crisis services where we go out and we assess individuals. Do they need to be hospitalized? We actually have a mobile crisis team, and that team, just like the term sounds like, they go out to an individual's home. They assess. The objective there is to de-escalate and to prevent hospitalization. Community living supports where people come alongside other individuals to increase their self-sufficiency. And some of these services, I should have mentioned back on the first slide when I talked about the work we do. So those are adults, and I guess I did mention that, adults and children. So a lot of these services go across the board, but some of them, like home-based, are specifically for children's areas. And so some of these services are newer, and I'll have Kristen just kind of touch base on some of those newer services that we have through the grant.
Do you want to talk about them now?
Yeah, go ahead, just touch base like on ACT and the care management, care
Okay,
coordination.
so assertive community treatment, or ACT, is one of our new programs put into place last year through the federal grant we have, and they are a team of 4. It's a therapist, a nurse, a case manager, and a peer level aide. And what they do is they work with some of our more high intensity, high needs population that without that program tend to have a frequent, I guess, recidivism of hospitalization. And so this program works to keep them in the community. They help with, a whole plethora of things. They can, in the home, help with like budgeting, figuring out how to make healthy meals, med compliance. They also can transport to appointments, like to doctors, to see us, to go to Social Security. In addition to doing the therapy and nursing, they also work with our medical director and psychiatrist. And so far, we've had a really good success with that program. There's a specific ratio. They can have 10 clients per individual, so they can maximum serve 40, and currently we're at 31. We are looking actually to add to the team so that we have the ability to expand. So that's one of our new services. And then the other 2 that came about with the grant are care coordination and care management. So we have a couple of nurses and a care coordinator on site now. Again, looking to incorporate the physical health along with the behavioral health. So they do primary care screenings. They look at blood pressure, height, weight, medications, health history. Within the next few weeks, we're going to be able to start doing A1C testing on site. And so we found that, one, that's been really helpful because a lot of our folks don't necessarily go to the doctor regularly. And so now that we have this on site, we're able to help manage those conditions when they're coming in for other reasons. And then they also do coordinate with any other providers. The care coordinator kind of works similar to a case manager, where she helps connect them with anything they may need in the moment. The social determinants of health screenings that Rich was talking about, she's one of the individuals that reviews those and reaches out to those individuals. So if they're saying, I'm having problems with food, I'm having problems with transportation, she reaches out, connects to help them know where in the community they can go to get help with those things.
You'll see some other services you probably recognize up there as well as case management, outpatient therapy. There's probably 2 that we're more known for. On the next slide, you'll see a continuation of services that we provide. I'll link 3 of these together: parent support partners, peer support specialists, recovery coaches. Those are all services that individuals with a lived experience will come alongside somebody and help them on their path to recovery. So it may just be, for instance, a recovery coach is somebody that has a lived experience with substance abuse or misuse, right? So they can speak to our system, how our system works. They can explain their own story and their path to recovery. And that connects, quite frankly, differently than if Kristen as a clinician or me as an administrator speak to somebody on the services that will help them. That can connect, and that certainly is helpful. But if a peer speaks to that, somebody that's already gone through that, that's a whole different game, and that connects in a different way. And we have that with recovery coaching. Peer support specialist is more on the mental health side, and then parent support partner is just what it sounds like: parents supporting parents with kids that have disabilities. You'll see on there too that we also have a prevention program, and many of you have seen Liz come here and speak about the services that prevention provides throughout the community. Supported employment. So we have started about a year and a half, or a couple of years ago, we started an internal supported employment program to help individual obtain employment based on their wants and needs. And so again, giving them options and choices with their income. With the grant that Kristen spoke about, will speak about here shortly, we've been able to expand greatly veteran services. So that may be case management, linking and coordinating with other resources, and certainly therapy. And then wraparound services is a program that we have for children. It's a team-based, oriented kind of service. And so that kind of gives you an idea of, like, hopefully who we are, what we are, kind of some of the prevalence of mental health in the United States, but also locally, and so the need for the services. And so with that, with the change with mental health going on, we jumped on board about 1.5 years ago with CCBHC, or Certified Community Behavioral Health Clinic grant. So it's an expansion grant from SAMHSA. And I'll let Kristen just kind of speak on what that is and what that's allowed us to do.
Yeah, so our grant actually began in August of 2021, and really the big things about it was we were able to expand both services and the populations that we serve. So service-wise, I already talked to you about ACT. We also, with veterans, I would say our veterans program mostly has been working on building infrastructure and relationships right now. We found that the percentage of veterans that we see as compared to those in the community is pretty low. So we do have someone who is a veteran herself, who is our case manager, who's been connecting with lots of different people in the community and trying to find a way that we can reach that population better. We also were able to expand our outpatient access. We added some additional therapists. We have some numbers in here of the additional clients that we have served. One of the big things of that is prior to this grant, we were not able to see the mild to moderate mental health at our CMH, and now we are, which was a huge thing because there wasn't a whole lot of other resources for that population within the county. So we are able to do that, and the medical side of things that I talked about earlier, that we have been able to add, in addition to just behavioral health, our care managers. We've expanded our training to our staff. One of the things with CCBHC is to have more what they call evidence-based practices. So we have several therapists right now who are in the process of becoming certified in trauma-focused cognitive behavioral therapy, used with children who have had a trauma, working through with the family. We've done motivational interviewing. Our goal was to have 100% of our therapists trained. I want to say we're pretty close with those who were with us when we started. I think there might be 2 who haven't gone to training yet. We've done health equity trainings on site. We've done LGBTQ trainings on site. We have several staff going to dialectical behavioral therapy. So we've just really worked to not only expand, but improve the skill set of the people that we do have. So our grant ends actually at the end of August this year. We're expecting some additional opportunities through SAMHSA to apply for to continue on the same path. My understanding is that they announced those in March or April, so that's to be determined.
Who is SAMHSA?
SAMHSA, they have not changed their name yet, so they are still the Substance Abuse and Mental Health something administration.
Yeah. So SAMHSA is a federal organization that supplies funding for mental health or substance use disorder work. So they typically supply grants in grant form. So.
Thank you.
I should know what they stand for, but
Right,
I'm so used to calling them SAMHSA that I don't.
The last thing that we want to touch base on is just kind of give you an idea of like how all of this is funded or paid for. And you see some basic stats up there about our budget. Most of our money is Medicaid, 90%, but then the other 10% is general fund. The county generously supplies a little bit of money, and then we have third-party billings that we do, and that's increasing well, I shouldn't say greatly, but it's increasing slowly with the CCBHC grant, and then we have other grants. And just to give you a little bit more insight on how the funding works, like most of our money is like I said, Medicaid. So you have the state of, how that passes, so you have the state of Michigan, and then there are 10 prepaid inpatient health plans within the state of Michigan. So you have the state of Michigan, and then you have 10 regional hubs, right? So the state of Michigan takes the Medicaid, and they pass on that Medicaid to these 10 regional hubs. Under each regional hub will be X amount of community mental health. So we belong to Southwest Michigan Behavioral Health. There's 8 CMHs along the Southwest region here. So to track that Medicaid, the state of Michigan will pass that Medicaid money and Healthy Michigan, which is Medicaid expansion, onto SWMBA, Southwest Michigan Behavioral Health. SWMBA then takes that money and passes it on to the CMHs based on Medicaid eligible people in that county. So a county like Kalamazoo might have more Medicaid eligible people than Berry County, so they get more Medicaid funding. So that's kind of the breakdown on how that works. So hopefully that gives you a little bit more insight to like who we are, what we do, the services we provide, and a little bit more about the grant and the access to care. The two things that we hear a lot from community, but also from politicians, are that there needs to be increase in access to care, and then we need to integrate that care. And what Kristen was talking about, what that grant allowed us to do is do both of those, and we're continuing to hopefully do more of that. So we thank you for your time, and we'll answer any questions if you have them.
Excellent presentation. And having 4 new commissioners on the board and having not seen you guys for a little while, it's great to get that information and get the refresher there. But questions from commissioners? Commissioner Tennyson?
Have you seen a bigger need for services since the pandemic? I hear that a lot, that a lot more people experience a lot of mental, problems because of being locked down or whatever. I mean, does that continue, or is it getting better for people?
Yeah, you might be closer to this than I am. I know like some of the numbers we showed there. So fiscal year last year compared to the first quarter of fiscal year last year compared to this year, first quarter, we had like like a 30 or 30-some% increase in services. Now, whether all of those are due to the impact of the pandemic, I can't say that.
Yeah.
I would say that we've seen an increase mostly in substance use and children's services. But again, I can't say for sure that the cause was the pandemic, but those are the 2 areas that we really saw a pretty big spike in the last, I want to say, year and a half, 2 years. Initially, things were pretty quiet because nobody was coming out and we were getting telehealth up and running. But once people started getting back out, those are the 2 areas we saw the most of.
Well, I think it had quite a major effect on kids when they weren't interacting with other kids for that
absolutely.
length of time, and I just didn't know if it was getting better.
Yeah, we're still getting an increased demand for calls, and if I recall correctly, the most requests for service would be therapy followed by case management. So therapy engaging in that service, and then case management coordinating all the different services.
Thank you.
Commissioner Campbell?
I have no questions, but I would just like to say that this is probably one of the most important services we have in Berry County. If you've been blessed and never been touched with it anywhere close or in your families or something, you're blessed, but it's everywhere, and we need to keep working with it.
Yeah, appreciate it.
Vice Chair Hatfield?
No questions. Thank you for the presentation.
I want you to know I did figure it out. It's Substance Abuse and Mental Health Services Administration.
There you go.
I wouldn't have known no matter what you said.
There are lots of abbreviations.
There are.
So, Commissioner Doster?
The board here appointed me to SWMBA's Substance Abuse Recommendation Committee, I guess, and then, Rich, you serve on SWMBA itself, is that correct?
So I serve on what's called the Operations Committee, which is acts as a advisory committee to SWMBA. So the Operations Committee is made up of all the CEOs 8 CEOs I can't even speak this one. The 8 CEOs within the region make up the ops committee, and then we provide advice to SWIMBA. In essence, what that is the CEO of SWIMBA.
And then SWIMBA is these 8 districts or 8 counties all to the south of us. We're the furthest northern county. The substance abuse portion that I sit on, their main source of funding is what they call P2 funding.
PA2.
PA2,
Yeah.
which is the tax on liquor, the liquor tax, and then half of that gets funneled into the county, and they administer the rest of it. And there are funds that eventually accumulate there as well. It's my understanding that they're going to we have a 3-year agreement with them, and it's called an intergovernmental agreement.
Correct.
And it is due to lapse this year, or at the end of this year, I believe. And so some representatives from them will be coming to the board to have us re-up that governmental agreement if we choose to do so. We would like your insight, obviously, on that when we get to that.
Yeah, and I don't know if many of you were around back in, I think it's 2012 or 2014, the legislation rolled the coordinating agencies into the PIHPs. So way back in the day, substance abuse was overseen kind of by a separate entity called coordinating agencies, and there were several of those throughout the state. And I think it was 2012 or 2014. At that time, it got rolled into the mental health, the regional hubs that we have. And so with that, there's then became this oversight committee, which Commissioner speaks about, that he sits on to oversee the funding for substance abuse. And so the intergovernmental agreement is between the county and SWIMBA, which allows for that substance abuse treatment and services to occur within the region.
Okay, thank you. I noticed a program, I also sit on the mental health board here, the local one, that there's a program that seems to be doing rather well. I was wondering if you could speak about the Narcan and the lockbox availability?
Yeah. So Narcan is a medication or a drug that reverses the effects of opiate. And so what the kits, the lock boxes or the kits typically are placed in locations around the community. And so this is a project that our prevention team is heavily involved in. And I think there are 11 or 12, 13 sites throughout the community that will have these lock boxes which contain the Narcan. And so individuals that need a kit or know somebody that engages in that type of activity might take a kit to provide safety to them. The term is called harm reduction, so certainly if we can, we don't want to promote the use of illicit drugs, but if we can bring somebody back from an overdose and give them a chance for recovery, then that's the idea there. And so 2000, I didn't come prepared with these stats, but I think 2022, we distributed like 500 of those kits throughout the county. And so far in this year, that team has distributed an additional 122 kits. And so sometimes they'll have events where they'll use our parking lot and people drive up and they'll pass out a kit for them. And sometimes those lock boxes, they'll just pass out the lock boxes and people will use those for other purposes. But so that's in essence that program. We want to get that medication out in different areas where people that need it can use that and have an opportunity for recovery.
Okay, thank you.
Our nurses also hand them out when they do screenings.
Oh, okay.
So we try to hit everybody we can. They give them out whether it's for someone themselves coming in that's an opiate user, or if they're reporting someone in their family is.
Great. I was also going to ask you whether you thought that there was going to be an additional vacancy on the mental health board. We'd had someone who hadn't participated in quite some time. I know we wrote them a letter.
Yeah. So I guess my comment to that would be, we have one current opening right now, and, yeah. There's follow-up on that other position, but nothing that I could report.
Okay. So by the time that we actually make that appointment, you should know whether that's a dead end and whether we can,
I think you should know, yeah. You would know by then, yes.
okay.
Yeah.
We could go forward and possibly make 2 appointments on there. Okay, thank you.
Awesome, thank you. Commissioner Colton. Commissioner Getty.
I had a question about inpatient services, so both for inpatient substance abuse disorders and mental health inpatient beds that are available. We heard a lot that we have a shortage of beds in our community. I don't think we have any inpatient facilities in Berry County, but we refer out of county. Has there been any improvement with that?
Yes and no. There are a lot of factors that go into that. I can speak mostly to the mental health side I have more familiarity with. Adults are much, much easier to place than children. Children under the age of 10 are really difficult, because even those that take adolescents don't take children that young. So sometimes those will require, someone will be in an ER while we're trying to find placement for a couple days. With adults, it sometimes depends on rationale for why they're going to be hospitalized, and sometimes how they're behaving in the ER and who brought them to the ER. Hospitals can tell us that people aren't appropriate for their milieu. My question is always, if they're not appropriate for you, who would they be, as you're the highest level of care? Our substance use goes through SWIMBA. That's actually who places them. I know this week we've had a couple actually that were placed pretty quickly, so it seems like on that end it's going better. I know what I hear most is the challenges with adolescents.
And then when individuals go through substance abuse treatment and they return home, we've heard a lot about the difficulties that they face in that transition back to the real world, and then being able to stay clean. Has there been anything that you're aware of in terms of transitional housing in Berry County?
I've heard talk of it, but not that has come to fruition yet. I know there was talk of actually some private citizens, I want to say, who are looking into.
Yeah, there is a couple, or I don't know if they're a couple, a group of private citizens that are looking into bringing that type of thing to Berry County. It currently doesn't exist and would be a needed resource. So we've met with them. Christine, Christine Heyer, she's met with that group and kind of explained what the process would be, who to connect as far as for funding, and would they need to be licensed or not, and things like that. So I would say that's at the very beginning stages.
And the other thing that we're looking at is our ACT team that serves the mental health. They can be cross-trained in something called IDDT. It's integrated dual diagnosis treatment to work with individuals who are substance use primary. And we have asked for funding that we have ready. We just need the training to be hosted by someone.
I know when I was on the board, hiring, finding those individuals was a challenge.
Yeah.
So I'm sure it continues to be.
It still is. It seems to kind of go in waves. Like we had a wave where we hired several individuals, and now we have a few of those openings again.
Thank you.
Commissioner Smelker.
I was on the mental health board for a while, and one of the first things they done was give me a cheat sheet on abbreviations, and I really thank them for that.
Yeah.
And to tell you the truth, I was only on long enough where I was just starting to understand all the things that they do.
Mm-hmm.
But thank you for what you do.
Yeah. We appreciate hearing that, and appreciate the feedback from all of you, as well as, consumers that we serve and from the community. That's how we know whether we're helping people on their individual, I speak to their individual path of recovery, because everybody's path is different, whether that's mental health, substance abuse. Quite often it's both. So it is a huge challenge. It affects, if you just think of 1 in 5, that's a pretty good number. Probably all of you sitting on this panel or this board know somebody that's been affected by substance abuse or mental health. I'm sure both of us do. So it's huge. Part of us just getting up here speaking is to lower that stigma, so people can feel more freely to come to services and be better at what they can do.
That kind of leads me into my question, which is, we saw what happened at Michigan State a month ago. There seems to be more severe cases, and is there a training, is there a process, is there identification? How do you reach out to somebody when you perceive somebody is struggling and in need of help or services? What's the process? How do you guys teach somebody when because you've seen red flag laws, you've seen all these different things that, Lansing tries to push through, and they're working on some stuff now to make this all better, but it doesn't seem to help. It starts locally by somebody who's a friend identifying. I don't know if you have any insight as to what we as individuals can do if we see someone that's struggling. What's the process to connect them to services?
Yeah, I don't know if you want to speak, or I got a couple of thoughts, but I'll let you.
Well, I have a couple of thoughts, but I don't know. I go on sometimes on a little bit of a soapbox about this issue with mental illness and crime. I will say those mentally ill are like 75% more likely to be victims than perpetrators of crime.
Okay.
As far as people struggling, with our mobile crisis teams and our crisis teams in general, that's probably one good way. The individual has to be willing, unless it is to the point that someone can petition them into services against their will. So it really depends what warning signs somebody is seeing, and if the person is at all willing.
Yeah, solid point. So I prepared a presentation that I think sometime this spring I'm going to do with one of our pastors at our church. And so one of the things we're going to talk about is just what Commissioner Jackson asked. So, like, how do you assist somebody in getting help, right? And so if you recognize that somebody is acting differently, they're really struggling, maybe they're not as engaged as they normally are, they're not eating, you can tell they're not sleeping, they're just really struggling, right? The first thing is to be present with that person. And so sometimes being present doesn't necessarily mean that you're asking a lot of questions. It just means physically being present with that person, being mindful of the conversation. And so that's a help, right? We talk about asking open-ended questions. So most people aren't going to have the training, motivational interviewing that Kristen talked about. But when you ask an open-ended question, which is part of that training, that breeds conversation. If I ask Commissioner Jackson, do you have a green shirt on? He's probably going to answer yes. End of conversation, right? But if I ask him a different question, it's not a yes/no question, it breeds conversation. So we talk about that, ask open-ended questions. If you get to the point where you see those red flags, ask the question. Go right out and ask, like, are you struggling mentally? Are you struggling physically? Have you thought about seeking help? You can ask the S word. Have you thought about suicide? Asking the question does not increase the risk of suicide. In fact, the data shows that it actually decreases it. So we will talk about those things. But like Kristen said, at the end of the day, and I guess then the last thing is then to ask that person, if you're willing to seek help, I'll go with you. You don't have to do this alone, type of thing, because we are kind of a scary process and scary thing, and do I call mental health, or do I go to the hospital, do I go to Pine Rest? So that type of thing. The bottom line is the individual has to get to that point where they're willing to engage in getting better. And so we kind of end that by having the person think or reflect on, are you on a path that's getting better, or are you on a path that's, your life is not getting better? And if the answer is that, well, my life really isn't seem to be getting better, well, okay, let's start to make some changes, So that's what I'll be talking about in a few months, in a different location, but hopefully that helps.
Yeah, absolutely. And just a follow-up question to that, when is it appropriate when you feel somebody's becoming a danger to themselves or maybe to the community? When is it appropriate for me to reach out or anybody to reach out and say, hey, what do I do? Or how do you report this? Do we call community mental health? Do we call the sheriff? Who do we reach out to?
I would say it would depend on the immediacy. If you thought
Okay.
there was an immediate risk, I would call the sheriff. If you call us and that's what you're telling us, they probably are going to be involved at some point
Okay.
to pick this individual up to have them assessed.
Mhm.
So they'll end up in that situation if they need to be assessed with the sheriff going anyways, but immediate, then I would say skip us.
Because it's a constant, every time you see it in the news cycle, it is, if they only could have got help. If somebody who knew this person could have done something, and that's the question, is how do we help these people to get help sooner, quicker, to prevent harm to themselves or others?
Right, and a lot of times there's family or friends that may be aware of the mental illness, this severe change in behavior that somebody's having, right? And so there is a petition process that I think Kristen spoke to or alluded to, that you can petition the courts to have somebody receive treatment or to have somebody hospitalized. And so they may not have insight to their own condition or their need for treatment. And so there's a process to help them out with that.
And we will help with those petitions. We've had people come in and ask us to help them fill it out, and so we will offer guidance. Like, we can't do it for them, and because you have to actually have observed what this person's doing in the last, I want to say it's 48 hours, and so we will help them if they need that, like if they don't know where. I think the biggest thing is awareness, to know if you're seeing something outside of the norm for someone and you think it's concerning. I think it's always better to act on the safe side and do something than do nothing.
Mm-hmm. Thank you. Well, again, I just see such a broad spectrum of services you guys offer and all the different things that come at you on a daily basis. So we really appreciate your staff and your team. How many employees work with community mental health at this time?
We probably have probably 85 or so.
Fantastic. So, no, we really appreciate the awesome job you guys are doing. I know it's a big need in the community right now, so that's a broad base of services, and we know you're there, and if we can do anything to help, please let us know.
Yeah, appreciate that.
Commissioner Getty?
I just had a follow-up question. With the mobile crisis unit, is that coordinated with law enforcement?
If needed, they can request that, but not always.
Okay.
So it really depends on the situation.
We worked on a model which is called CIT, Crisis Intervention Treatment, which would involve law enforcement and mental health. Our model was different than like some of the bigger cities where they would actually do ride-alongs. But at the time we were in the process of trying to implement that model. Not all our law enforcement partners were fully staffed, so that caused some challenges there. But we would like to at some point re-engage that model. So that might look something like dispatch gets a call, and so if they know that that individual is experiencing a crisis, maybe law enforcement passes that on to us, or we go to the site at the same time, or they call us from the scene and we're able to work with that individual.
Thank you.
Rich, do you guys have a Facebook presence at all? I don't know that I've ever seen anything from Community Mental Health that says we're here, we're available, if you're struggling, call us.
We do. I'm pretty sure we have it's not my gig, but I know we have a Facebook thing, so somebody does that. And I think we have recently, Instagram
I think
or,
maybe, yeah.
yeah, so we do,
It sounds horrible, but I don't.
yeah,
don't
we do, I know we
social
have a Facebook presence, and the substance abuse prevention team, they have a separate Facebook presence. And so new things we're doing, we'll occasionally throw on that Facebook, so,
And we've done some mailings, because we mailed to, I don't remember the 2 zip codes, but we sent out something when we expanded services. And we're trying to get some of our materials out to local places. I know doctor's offices are our next one that we're heading out with.
Just awareness is a good thing, to see that in the community over and over and over again, to see that message out there. So where people can connect to.
We were in the community map thing too,
So-
oh,
that's
yes,
right.
yes.
But if you have ideas of how to promote it, I mean, we're open.
Yeah, I think I'm scheduled at Rotary Club in Kiwanis in the next few weeks to kind of give a very similar presentation on just the services, the need and the services we provide. But if any of the commissioners say, hey, you know, this message would ring pretty loudly at this event or this place, then, you know, pass that along to us, and whether that's one of us or somebody else, we would gladly get the word out.
Okay. We have one question from an audience member in the back. Mark?
Yeah, you mentioned on one of the charts, ADM rate. What is that?
Our administration rate, so the amount of money that goes to provide administrative services, like myself, as opposed to direct services to a client. So what that slide was, a better way of saying that is almost 91% of the dollars we get go directly to providing a service. Yeah. Good question.
Thank you. Appreciate all you do for the community.
All right, thank you.
Have a great day.
Thank you.
Public hearings, we have none. Items for consideration, Commissioner Doster.
Thank you. I would move that the following items for consideration be approved under transfers and disbursements. I move for the approval of prepaid invoices in the amount of $2,632,038.78.
Is there support?
Support.
Motion by Doster, support by Smelker for approval of prepaid invoices in the amount of $2,632,038.78. Is there discussion? Hearing none, Madam Clerk, will you call the roll?
Campbell,
Aye.
Doster,
Aye.
Betty,
Aye.
Hatfield,
Aye.
Smelker,
Aye.
Tunison,
Aye.
Carlton,
Aye.
and Jackson.
Aye. The motion is approved.
I approve for the approval of claims in the amount of $60,100.87.
Is there support?
Support.
Support by Hatfield. Motion by Doster, support by Hatfield for approval of claims in the amount of $60,100.87. Discussion. Hearing none, Madam Clerk, will you call the roll?
Doster,
Aye.
Betty,
Aye.
Hatfield,
Aye.
Smelker,
Aye.
Tunison,
Aye.
Carlton,
Aye.
Campbell,
Aye.
and Jackson.
Aye. The motion is approved.
I move for the approval of commissioner reimbursements and mileage in the amount of $554.79.
Is there support?
Support. Campbell?
Motion by Doster, support by Campbell for approval of commissioner reimbursement mileage in the amount of $554.79. Discussion? Hearing none, Madam Clerk, will you call the roll?
Getty,
Aye.
Hatfield,
Aye.
Smelker,
Aye.
Tunison,
Aye.
Carlton,
Aye.
Campbell,
Aye.
Doster,
Aye.
Jackson.
Aye. The motion is approved.
I move for the approval of the attached revised job description for the ITGIS, and I guess, position.
Is there support?
Support.
Motion by Doster, support by Smelker for the approval of attached revised job description for the ITGIS Deputy Director position. Discussion. Michael.
Good morning, thank you. After further discussion with Dave Schinover, pass it around. We'd like to change that motion, if you will. So from a historical perspective, in 2021, and it's outlined a little bit in the agenda request form, in 2021, the position that existed and is being passed around right now is a network administrator. We identified the network administrator as a candidate to replace our director when he retires, and as such, established a deputy director position, promoted him to that to develop that individual with the idea that he would replace the director when Dave retires. That individual has since left our employment, taken another job, unfortunately. But something we weren't able to control. So what we're now proposing and think is the appropriate avenue is to go back to the network administrator, to reestablish that position, which admittedly is a lower compensated position. It is a classification 11, pardon me. The department head, or the deputy department head position, was a 14. But that position, the department head or deputy administrator position, was established for a kind of a specific purpose. We don't know if we'll be able to attract, that's one of our concerns, a network administrator. Admittedly, we are a unique county for a county of our size. We were fortunate to have our own network administrator, but we think it's the appropriate course is to at least go out and pursue that, see if we can fill that. If we can't, then we'll be back to talk about contracting, and that is not an uncommon course of business for a county our size. But we'd like to, as opposed to filling the deputy administrator position, ask that you, so effectively we'd ask that you table or withdraw that. I guess the appropriate would be to withdraw that motion and permit IT to advertise for the network administrator position. So I said a lot. Hopefully it got there. It felt like I was kind of going the long way around the barn, if you may, but we got there. So I'll try to answer any questions.
Questions for Michael?
Mr. Chair, so it's my understanding then that the deputy director position was created basically to have somebody with gain advanced experience that could then replace Mr. Schinover then when he retired. Is that correct? So it was an anomaly or a special position with that in mind. We didn't have that person under contract, and they found another position.
That's correct.
And left, and so now you're looking for returning to the original position that had existed prior.
That's correct.
Okay. I would, do I have to move? I can just withdraw the original motion, correct? We don't have to have a motion on that, right?
You do not.
Okay.
The appropriate would be that you would withdraw, and whoever
And
made
withdraw
the second would withdraw,
Okay.
agree to withdraw their second.
I'd be willing to withdraw the motion, the prior motion.
Second? I forget, I don't know if we have that note.
Did anyone second it?
I'm assuming somebody did.
Okay.
John did?
John did, okay.
Withdrawn.
Okay.
Motion withdrawn?
I would make a new motion then to approve the newly attached revised job description for, and this is also an IT position, correct?
That's correct.
IT network administrator position.
Second.
Okay. Motion by Doster, support by Smelker for the approval of the attached revised job description for the IT GIS network administrator position. Further discussion?
I would just, for a clarification point, there isn't any revision to this job description.
Okay. Oh, okay.
It was one that had been, existed was no longer being used. We're just asking now for that one to be reauthorized, if you may, and the deputy director to now be put on the shelf.
Okay.
Okay, so for clarification, motion by Doster, support by Smelker for the approval of the attached job description for the IT GIS network administrator position.
Perfect.
Discussion. Hearing none, Madam Clerk, will you call the roll?
Hatfield,
Aye.
Smelker,
Aye.
Dennison,
Aye.
Halton,
Aye.
Campbell,
Aye.
Doster,
Aye.
Getty, Jackson.
Aye. The motion is approved. Thank you, Michael.
Thank you.
Unfinished business, we have none. New business, we have none. County Administrators Report.
I'm all set, thank you.
Thank you. Chairperson's report. Attended the Rutland Township meeting last week. Also attended the EDA board meeting. Just a few notes on there that the Jefferson Street St. Patrick's Day Parade is this Friday. The Mid-Villa project, which I know Catherine is working on, is back on the agenda. I know they're reviewing and revising some of that. And Jim McManus said the county planning and zoning is working diligently on the master plan, which will be coming back to us in short order for review as well. Very short order, apparently.
Yes, it's in final revision
So,
stage.
as another side note, Chelsea Foster, who's a member of the Hastings Rotary, I think some of you are Rotarians as well, they are running the kind of the festivities for the Barry Roubaix this year, and they are in need of about 75 volunteers to help with that party on Friday night and Saturday most of the day. There are close to 4,000 bikers coming to Barry County. It is a good day not to be on the roads. So there are bikes everywhere. But it's an awesome event that brings a lot of attention to the county, a lot of good insight. And if you haven't had a chance to attend the event, or the after hours down there for the awards and the celebration, it's quite an event. So with that, Vice Chair Hatfield.
Everything's happening over the next 10 days, so I really have nothing to report. Unfortunately, I was not able to make the Planning Commission meeting yesterday because I was participating on the border review for the city of Hastings, but we've gone through the second review of this now. They have done an outstanding job on this. I think you'll all be not excited, at least encouraged by what you see here once you get a chance to review it.
Okay.
It's light reading.
Yeah. Will we be getting a copy of that at some point for review?
At some point, yes.
Okay. Commissioner Campbell.
I attended Assyria Township meeting. They're working busily on a new website down there, and also they share fire department responsibilities. There's Bellevue for them, and so they're continuing to view different options there. Also visited Johnstown. They're in a cooperative effort with Baltimore for a special assessment for weed control on Clear Lake. That's all set up and ready to go. And also they're working to establish their township blight ordinance. And I too attended the Community Action Agency last night.
Awesome, thank you. Commissioner Tunison.
Commissioner Carlton and I attended Carlton Township last night, and we both talked a lot about the COA and the Thornapple Manor and new project, and very well received, I thought, didn't you, Commissioner Carlton? Mm-hmm. It was. And I got Hastings Township tonight, so.
Awesome. Commissioner Doster?
I have nothing further. Did we still intend to go into closed session, do we?
Yes.
Okay.
Commissioner Carlton?
Yeah, I've been talking about the COA at I have 6 municipalities, 4 townships, and 2 villages, and it seems like this is odd because it seems like whenever there's change, there's a certain amount of consternation, disagreement, and turmoil, but this has been very unique in that it seems like everybody thinks it's a great idea.
Awesome. Glad to hear that. Commissioner Getty.
I had a busy couple of weeks. I attended Thornapple Township last night. They regrettably accepted 2 resignations, one for their clerk and one for their treasurer. Both were expected. So they had, they did appoint the deputy treasurer to replace the treasurer, Deb Buckawing, and they appointed Elaine Denton, who was a past clerk for the Village of Middleville, to temporarily fill the Thornapple Township clerk position while they did a larger search for a clerk. They held a public hearing for the Nofke Road project and their budget as well. I attended Yankee Springs Township. They voted to pursue a DNR passport grant for park improvements to their Yankee Springs Township Park, which would include the expansion of their half-court basketball court and add an additional pickleball court. They have the basketball court gets used quite a bit, and from a handicap basketball player and team. So I think there'll be those improvements to the Yankee Springs Township will enhance those the ADA compliance of the park, which is always great. And they're ahead of schedule on their township office renovations, and they expect to be moving in soon. I think we had our last meeting that has to be held at the church. Also attended the Village of Middleville. They are reallocating some of their ARPA money that was dedicated to study the location of lead pipes. And they were able to get a grant for that project, so now they can put some ARPA money actually into the replacement of the lead pipes. And they have a St. Patrick's Day celebration on Friday as well in the little village. I was able to join Commissioner Campbell in Johnstown Township. I think it's always nice to get out of your district and see other townships as well, and what a nice little township that is.
Commissioner Smoker.
Mine was pretty calm. I had the Village of Freeport last night, and everything, they just paid the bills, but with the ARPA money they received, their water mains are in the ground. That is all done, and they're starting on the refurbishing of the water tower.
Awesome, thank you. Limited public comment. At this time, any member of the public wishing to address the board may do so for up to 3 minutes. Good morning, Adam.
Good morning. Adam Heikkila, local business owner, former Bedford Township supervisor. I got here today, a copy for all of you. If you would like a digital copy, I also have a pocket full of thumb drives that has it on digital copy. So this is the Doctrine of the Lesser Magistrates. I brought it up before. I'm going to read the back to you guys here today. It says, America has entered troubling times. The rule of law is crumbling. The massive expansion of federal government power with its destructive laws and policies is of grave concern to many. But what can be done to quell the abuse of power by civil authority? Are unjust or immoral actions by the government simply to be accepted and their lawless commands obeyed? How do we, when the government has acted, how do we know when the government has acted tyrannically? Which actions constitute proper and legitimate resistance? This book places in your hands a hopeful blueprint for freedom. Appealing to history and the Word of God, Pastor Matthew Truella answers these questions and shows how Americans can successfully resist the federal government's attempts to trample our constitutions, assault our liberty, and impugn the law of God. I would actually add to that this also has to do with you all the way down here at this local level. The doctrine of the lesser magistrate declares that when the superior higher civil authority makes an unjust, immoral law or decree, the lesser or lower-ranking civil authority has both the right and duty to refuse obedience to that superior authority. If necessary, the lower authority may even actively resist the superior authority. Historically, this doctrine was practiced before the time of Christ and Christianity. It was Christian men, however, who formalized and embedded it into their political institutions throughout Western civilization. The doctrine of the lesser magistrates is a historic tool that provides proven guidelines for proper and legitimate resistance to tyranny, often without causing any major upheaval in society. The doctrine teaches us how to rein in lawless acts by government and restore justice in our nation. So this is a book. This is he's a friend of mine, Pastor Metruel. I've met him a couple of years ago now, and we've been in communication. And so this is what I've been talking about with you all. He's actually in the state right now. Unfortunately, he's on a tour over on the east side of the state, so it'll be a little difficult for you guys this week, I'm sure, to get out. But later on this summer, he will be on our side of the state, and I will make sure I get the dates so that you guys maybe can have an opportunity so you can see him in person, ask him questions, and reach out to him further. But I do have a copy of the book here. Is there anyone of you that would prefer to have a digital audio? Would you prefer to listen to it instead of hear it? Is there anyone? Anyone?
I'm a book guy, so.
You're a book guy? Are most of you guys book guys?
Yeah.
Yeah? All right, awesome. I'll get you a book.
Thank you, Adam.
Again.
I appreciate that.
Thank you.
Thank you.
Is there additional public comment? Good morning.
Like a Hollywood actor, I carry my headshots around with me always. This is the list. We're now at 297 homes, 435 signatures, a little slowed down over the winter. But really, I just wanted to talk today based on something that I heard that was at a meeting, hadn't been here in a while, on February 14th, where our PLA president got up here and spoke and said, you know, she was here as a private citizen, which was cool, but also identified herself as the PLA president, and said something along the lines of, this isn't real, and we don't really have these signatures. We really do. This is really proof. I think we need to get to a point where we can put this idea to bed. And I don't know how we do that, because 3, 4, 5 people can come in here en masse and say, most of the lake is for this thing. You know, I have actual proof, but no one's gone through these one at a time. I think somehow we need to do some other kind of a mailing from a central authority, not Jim Dull, because he's obviously biased. Maybe some kind of bipartisan committee put together, which in my mind, he might not want to hear this, but to my mind, it should be chaired by our representative, Mark Doster, to get someone from pro-drain, get someone from the anti-drain. Let's send another mailing out and let's find out what people really believe. I have no concerns because I know what's real and I know what the feeling is on the lake. So I'm hoping you'll consider that, because I know this is only one part of this overall thing, but it's just, it wastes your time to have 1 or 2 individuals come in here and say, yes, I'm for it, I'm against it, no matter which side they're on. Let's put this item to bed, and then we move on to figure out what the other aspects of it are. Thank you.
Thank you. Bob Hadley.
Oh, I'm sorry.
Bob Hadley? Bob Hadley? Okay. Additional public comment? Hearing none. Commissioner Smelker.
Mr. Chair, I move to go into closed session in accordance with Public Act 267 of 1976, subsection 15.268, section 8D, to consider the purchase of real property.
Is there support?
For Doster.
Motion by Smelker, support by Doster to go into closed section in accordance with Public Acts 267 of 1976, subsection 15.268, section 8, to consider the purchase of real property. Madam Clerk, would you call the roll?
Smelker,
Aye.
Judison,
Aye.
Halton,
Aye.
Campbell,
Aye.
Doster,
Aye.
Getty,
Aye.
Hatfield,
Aye.
Jackson.
Aye. The motion carries. At this time, we'll go into closed session. Michael, are we meeting in the jury room?
Downstairs, yeah.
Okay. Downstairs in the jury room, second floor.
Oh,
The board is called back into open session. I need a motion for approval of our minutes of closed session. Open session. I need a motion for approval of our minutes of closed session.
Second.
Motion by Hatfield, support by Getty for the approval of our minutes from closed session. Discussion? Madam Clerk, would you call the roll?
Aye.
Judison,
Aye.
Halton. Oh, he's absent. Campbell,
Aye.
Doster,
Aye.
Getty,
Aye.
Hatfield,
Aye.
Smelter,
Aye.
Jackson.
Aye. The minutes are approved. To wrap up our agenda for today, we have commissioner comments. Commissioner Tunison.
I'm good.
Commissioner Campbell?
I'm better.
Just about 2 minutes, though. We're watching you. Commissioner Hatfield.
I guess that makes me best.
Commissioner Doster.
Nothing further.
Commissioner Getty.
I love the direction we're going.
Thank you. Commissioner Smelker.
I do too. I think we're moving along nicely.
Okay,
I
perfect.
agree wholeheartedly with that one.
I have no further comments. We have come to the end of our agenda. We are now adjourned. Thank you all for your extra time today.
Thank you for your leadership.
I think we're pushing him in the right direction.
Vision, we need vision. That's what we need, we need vision.
And I don't know whose idea it was.